I'm gonna need you to talk to me while I do this, while I check your arms and legs. Nice, high and tight. Alright, you go ahead and tell me, who are you? I know, come on. I need to ask this question for a neuro check. Alright, wiggle your fingers and toes. What time is it? Alright, where are we? Fantastic. We're going to take the back of your neck here. I'm looking for some spot. I'm looking for extra point pain. Okay. Excellent. Let me move your head up and down. I already saw you moving side to side. Perfect. Very well done. Okay. Wiggle your fingers. Wiggle your toes. Alright. Do you feel this? Excellent. If you're talking, I know your airway is intact. I will do my best to take care of you. I know that you did your best to take care of me. Okay, we're almost there. I'm just going to take you a little bit further, okay? Okay. Almost there. Alright, now we've got you settled down. We're going to go ahead and do our secondary survey, okay? So I'm just going to go over all your body systems again, kind of starting from top to bottom, okay? Alright. Any pain? I'm going to press on you here. On your head here. You're in the back. Okay, can you gently rotate your neck for me? Just real gently. Don't do anything that hurts too much. Perfect. Alright, check the back of your neck here. Oh yeah, if we'd still been under fire, I wouldn't even have bothered to check your neck. I would have just dragged you out here to safety. But I took that time back there to check your neck because might as well. You had a bad fall. Didn't want to do further cervical spine injury. Okay, perfect. Still no point tenderness there. Alright, I'd like to roll you over and check your back, okay? Alright. I'm palpating along your spine for drop-off. Same thing I was looking for before on your neck. Okay, wonderful. All the way down your spine. I know my hands are a little bit cold. Alright. Okay. Back over here. I'm going to put my hands just here on your chest. Okay? Take a deep breath in. And down. Okay, even rise and fall. Perfect. Okay? Push it on your belly here. Alright? Just watching your face. Okay? Alright? Gonna sweep along this arm. This is called a blood sweep, what I'm doing. Along this arm. Okay, along this leg, along this other leg. Okay. Alright, pardon me, here in the middle. I know that's a little uncomfortable, just gotta check. There's no bleeding back there. Perfect. Okay. Alright. Yep, I know that was a little awkward, but gotta make sure everything's okay. Perfect. Okay. What was that? Okay. Yeah, I'm just gonna be loosening up your tourniquet here now. I'm gonna check and see if the bleeding stopped or if I need to hold on to it. How quickly I need to get you evacuated somewhere else. Well, you're my only patient right now, so. Okay. So just gonna loosen this thing right here. Excuse me, pardon me. Alright, let's look and see how's that bleeding. Okay. Yep. Well, for this I'm gonna get a glove on actually so I can poke on that. Poke on that bleeding area. Yep, see? Nice gloves. Just check and see there. Okay. I know. Yeah, well, field sanitary is different than hospital sanitary. Right. Alright. So what we're going to do is I'm going to go ahead, kind of push here. Does that hurt? Okay. It looks like we don't have any new bleeding. So I'm going to go ahead and repack the wound. So you can look away if you don't want to see the bloody bandages. Take those off. Okay, then I have some Curlex over here. I'm going to repack the wound, bandages, and then basically with more gauze. Add some of these in. I'm just going to stick them right in, try to stuff them in as much as I can. Just opening that up. And stuff that in there. These are triple layer. I know I don't usually bring the box out to the field with me, just pack them in. What I usually do is pack them in Ziploc bags. Yeah, that's usually how I do it. Okay. I know that's uncomfortable. Now that I have that stuffed in there, I'm just going to cover it with this bandage wrap. Perfect. Okay. Looks like that's actually going to stay. So there's a little bit of an open wound, but you actually don't have any bone sticking out through. And your like when you wiggled your toes and the movement that I'm seeing of your leg here is actually quite normal and reasonable. So, can you go ahead and push that knee? Can I have you extend your leg against my hand here? Okay, excellent. All right. And then we have you bend your knee. Okay. Yeah, it looks like you got stabbed with that stick when you fell on it, but actually it doesn't look like you've got anything broken. So that's a good sign. So, I was really worried about your back with the way you fell. Yeah, absolutely. Well, you know. But I'm actually pretty happy with what I found. Yeah, so I'm just going to get some routine antibiotics on you. Alright. Perfect. Alright, let me get you some antibiotics. I'm going to give you oral pills. Yep, imipenem is what I would give IV. I'm going to give you moxifloxacin, okay? I wouldn't usually do this, but because of trauma and because you did get shot up a little bit, especially obviously in that leg. So it actually looks like you didn't get any bone damage. It looks like it just went straight through the muscle. So obviously I want that to get checked out at a hospital once we get out of here. Yeah. Here you go. Maybe you take 2 of these. Just go ahead and take them. I'm not going to feed them to you. Perfect. That's excellent. Yeah, the bleeding stopped. I'm happy with that. I don't have to give you any TXA or Hexton or anything horrible like that. Check your pulse here again. Okay. Actually, while we have some downtime, I'm going to pull blood pressure too. Well, I'm going by an algorithm, right? It's called the March algorithm. That's what I was doing when we were out in the field. Well, when we were not in this tent, right? As you do, you control massive hemorrhage first, airway, respiration, circulation, and then the last one is hypothermia, right? But, got you this. Just gonna take your blood pressure real quick. I think it's a little loud. I actually hate that sound. Oh, you like it? Yeah. You ever heard of ASMR? There you go. I'm just gonna go ahead and put this on your right arm, okay? Perfect. Okay. Yep, I'm just going to put this right in your brachial artery, and I'm just going to give a listen while we go ahead and pump everything up here. Do. valve. Yep, I usually pump over 200. And then slowly release. Kind of let it come down. Yeah, that light hiss as it releases, right? Okay, that's not bad. You're a little hypotensive. And you have lost some blood. So I'm impressed with how alert you are, but I'm going to give you some blood products, okay? Yep, and get you hooked up right over here. And I like the plasticky sound of the IV, huh? Just going to rip open the bag cover. Okay. I'm going to hang this over here. And it's just a small needle, okay? I'm going to have you can go ahead and look that way. Yeah, I'm going to put it in your right arm. Vein there is easiest to access. Alright, give me just a second here. So, well, I'll talk you through it. So what I'm doing here is first I'm prepping this needle. I just got to get the cap off this needle. And then I'm going to go ahead and insert the needle. I've got this part primed. Just very gently, carefully all the way in. And connect the tubing. Keep my finger on this tube before, on your blood vessel really, before I put the tube in. Okay. And now the saline port is in. And I just connect this tube. Sorry, it's called a saline lock. Alright. That's all done. Yep. Well, yeah, I cleaned off the area with the alcohol swab. That's what that smell is. Have to do that first. Yep. Hold on. Just gonna adjust this flow rate over here. Yeah. Well, it's pretty low. I'm actually surprised you're still awake with how low your blood pressure is. You lost a fair amount of blood there, but I'm really glad that the bleeding stopped. That's why I checked the back to see if there's bleeding somewhere else. Sure you're not having any abdominal pain? No? Okay. Well, I'm going to watch you for a little bit, just to make sure. Sometimes someone can seem like they're okay and they have a hidden abdominal injury. Don't want to worry you, but I'm going to be watching out. You let me worry about those kind of things, and you just worry about taking nice deep breaths, okay? Alright. So, yeah, so the secondary assessment is more of a head-to-toe assessment, and that's kind of what we're doing here. Give you a little bit of a blanket here so you can be a little more comfortable. Hypothermia is the other thing that happens to people after trauma like this. You get some blood loss because of that. Okay. Let me have you squeeze my fingers again. Okay. Perfect. Alright, and talk to me. Just say some stuff. Perfect. Alright. Can you feel this? Is this uncomfortable? Yeah, I know. I'm checking some of your, it's called AVPU. I'm checking if you're awake, verbal, if you're responsive to pain, if, what are you responsive to? Obviously you're not unconscious. Okay. Perfect. Alright. And then doing another quick sweep. Can you feel this? Okay. Can you feel this over here? And then down here, down here, and then wiggle your fingers and toes for me again. Perfect. Go ahead and raise your arms a little bit. Don't mess with the one with the board in, obviously. Okay? And the other one. The other arm. Okay, go ahead and lift this leg for me again. I know that's uncomfortable. And this one. Okay. Alright. Yeah, there was a lot of blood initially when you had, from this one, but I think we've pretty much stopped that now, so I'm pretty happy with that. I know you're happy to be off the tourniquet, right? It's very painful. Well, I'm gonna go ahead and get you a fentanyl lollipop, okay? You can just suck on that. Yeah, it's an actual lollipop. Well, actually, back in the States, I don't even bother to apply for a DEA license because I don't give out opioids at all in my regular practice. But in trauma situations, I have and use them for military applications or for field applications. So, obviously we're not in the United States right now, so. Alright. Yep. Your little lollipop, just go ahead and pop that sucker right in. Yep. I know, it tastes a little strange. It'll help with the pain. And help take care of things. If you were really bad and I was a little concerned, I would put on a little bit of ketamine. Yeah. Well, actually, there's an app you can use to help you determine what's the best. You're interested in medicine? Yeah. You gonna go into something like that? Very cool. Yeah, I have my gloves off now. Well, might show you the app later. It's called Deployment Medicine. It helps you look up the latest TC3 guidelines from the Army. And yeah. Well, not just the Army, it's supposed to be across all branches. Yeah, absolutely. Okay. I'm going to continue now, okay? That's okay, you're allowed to be chatty. I'm just going to continue. Alright, so just to review, I'm pretty happy with, we've kind of gone over our major systems, but I'm going to go ahead now that we have, again, a little bit of downtime. I've made sure that we've dealt with some of the emergency stuff. I'm happy with your breathing and your talking. I'm happy with what I'm noticing so far from the abdominal exam. I'm happy with the blood sweep and the check that we've done. Your blood pressure I'm a little worried about. I'm not going to give you fluids because since you lost blood, that can actually dilute your clotting factors and cause you to start bleeding again. So what I'm giving you instead is whole blood. So that's kind of what we've gone over. We got some antibiotics on board. We got some pain stuff on board. Yep. Yeah, I know it's pretty fast, but we get stuff done. I'm actually going to take a listen to your heart and lungs. There's not a lot of use for a stethoscope in a emergency situation, especially when, during the fight earlier. Like I said, I wouldn't even check your cervical spine if the fight was still going on. I would have just dragged you out. But since everything was a little more calmed down, I wanted to check before moving you and then do a secondary assessment here in a safe place. Yeah. So anyway, there's no use for a stethoscope in those kind of situations where it's really noisy. Then we use our hands and we check your pulse. But here I'm going to go ahead and listen now. Make sure there's... Nice deep breaths. Perfect. Very, very good. Well, right now I'm listening to your heart. But I do like the deep breaths because it helps get some of your sounds a little out of the way. I'll explain later. Hold on a second. Deep breath. Man, I hope that fentanyl makes you less chatty. I'm kidding. Nice deep breath. Beautiful. Okay. Yep. A little something on your face here, man. There you go. Ooh, you okay? You having a moment? Okay. You okay? Oh, was the light starting to bother you? Okay. I'm going to ask you some questions. Just kind of watch your mental status. At any point did you fall unconscious when you fell? No? But you felt a little woozy? Okay. Do you remember where you are? Okay. Do you remember what day it is? Roughly? Okay. And what's your name again? Okay. Good. And do you remember what happened? Okay. That's okay, we don't have to talk about it now. It would be a little early for something like that. I know you're coming down. The shakes that you're getting, a lot of times right after a big event like that, that'll be the adrenaline. That'll just be the adrenaline wearing off. I've seen it also in my pregnant ladies right after they give birth. Yeah. Just kind of coming down off of it. Yeah. No, that doesn't mean early PTSD, so you can't get diagnosed with PTSD until it's been many months after the event has occurred, actually. Yeah. No, that would be, and actually, what we would do to prevent PTSD is to just you got some leaves in your hair. You're a mess. You're a wonderful mess. So what you do to prevent PTSD is actually make sure that you get right back into the fight. There were some studies that they did on guys in the Iraq conflict, and people who were pulled out of the fight actually had a higher incidence of PTSD than guys who had a traumatic event and went right back to it, because they had the camaraderie of their buddies and they had that normalization of the trauma that made everything more normal, so they could continue their lives, kind of. Yeah. So no, I wouldn't. Yeah, no. What you're feeling is the acute stress right afterwards. The fentanyl will help with that. You just keep sucking on that lollipop. Okay. I'm asking you a few more questions, okay? I'm actually going to type up the answers here since I have my field laptop with me. Okay. Yeah, let me just get it all set up here. I don't know, it's making funny sounds. Okay. So tell me how you're feeling right now. Just in general, real quick. Kind of a general overview. How is your world? You got those shakes, right? Yep. Yeah, tracking that. Okay. Yeah, and I saw that. I was there, so. Alright. So that's your symptoms. Hey, any abdominal pain still? No abdominal pain now? Okay. Excellent. Any allergies? I know it seems totally unrelated to abdominal pain, but it's the next thing I gotta make sure. Yeah. Just double checking. I mean, I've been your doctor for a while. I know you don't have allergies to, importantly, you don't have allergies to any penicillins. You don't have allergies to any antibiotics or to fentanyl, right? But anything else I need to check. Okay. You taking any medications right now? I don't remember. Healthy as a horse, good for you. Oh, the antidepressant. Okay. Yeah, how are you doing on that? It's doing okay? That's good. I know it's so much quieter now. Just get this more general history now. Well, yeah, in a normal doctor visit, right? People take the history first. They ask these questions first and then do the physical exam. But in an emergency like that, so an emergency like earlier, just pick you up and go. We just do the bare minimum stuff, ask the bare minimum questions. You know, it used to be they would call it the ABCs. Now I use the March algorithm because that's how we learned it in the military. Yeah. Well, because in the military, when you're on, you know, in a life-threatening situation, hemorrhage is your biggest concern. So you're starting with massive hemorrhage. Yeah, not airway. You're not going to be like trying to intubate a guy while he's bleeding to death. Exactly. So, and then like the secondary assessment we just did, we're still kind of in an urgent situation. Still kind of checking some things. And so, you know, I wouldn't want to have this whole conversation and then get the blood products on board. Do the check, get that done first. Take care of each problem as we face it. Instead of the order in normal, you know, civilian practice is going to be history, physical, and then treatment, right? But instead we do our physical, we check as we go, ask any important questions as we go. And then now I get the final history. Yep. Other past medical conditions besides the history of depression, which is now controlled, you said? Excellent. Yeah, I was really glad that we could change that medication for you. A lot of people do better on the SNRIs than the SSRIs. It's just the problem is the SNRIs are a little more dangerous. Yeah, SSRIs are a little safer. Oh, absolutely. They take a long time to work. Alright. When was your last water? Okay. Last food? Last menstrual cycle? Alright. And the nerve ends. Alright. Looks like this bag is hanging really well here. I'm gonna get another pulse here from you, okay? A little chilly? Okay. Alright, I'm gonna get you another blanket. Take this around here. I'm just gonna leave this arm out. A little worried about that. Let's check your blood pressure again, okay? Your pulse is pretty strong. Oh yeah, in a really fast situation too, I would make my guess to your blood pressure based on your pulse. I wouldn't even bother to take a blood pressure. But since we haven't, we can do it. You're my only patient. It's different if I have a bunch of y'all, then I'm not doing this. But yeah, because when you got a lot, you gotta cut a couple corners to make sure you keep everyone alive. Alright, put this around again. Okay, brachial artery. Same thing, pump this up to above 200. Alright, and then let the air out. Nice. That's much better. I like that blood pressure a little better. I like it. How's your pain? Okay. Alright, let me just set this stuff aside here. Okay. Yeah. Yeah, no, we call that so the combat pain pack is Tylenol, meloxicam, and there's a benzodiazepine that we give too, kind of sedating, because sometimes someone will be like yelling and moving around a lot and I need them to calm down and be okay while I look at somebody else. Yeah, exactly. But then fentanyl for more serious, and then after that, or you know, sometimes it's useful to just give that to a guy while you're working on the other person. Yeah, just pop it in his mouth. because I'm watching you one-on-one, I didn't tape it to your finger, but I'm going to do that in case I need to sit down. So I'm going to get some tape here and just put that around your finger. Why? Well, because if you fall asleep with it in your mouth, you can overdose. And so if it's on your finger, no one stays asleep with their finger in their mouth like this. Maybe when you're a baby like this, but it's going to naturally fall out. Your arm is too heavy. Yeah. Yeah, exactly. Let me just check over here. Okay. No, that looks pretty good. And the bleeding still looks pretty good from this area. Can I poke on your belly again? Okay. Yeah, I mean, it did seem like you lost a lot of blood at the scene, but... no abdominal pain? Oh, what I'm looking for is if a dark bruise starts to form somewhere on your belly, then I'm worried about internal bleeding and about figuring out how we can get you out faster. Yeah. Yeah. Well, in the Army, to get you out, we'd call in what's called a 9-line medevac. And so we'd call someone and we'd list off basically there's a certain protocol that each line represents something. Why are you so curious about that? Yeah. I'm not going to go over what each one is here on the internet. Yeah, because it's kind of like each line is basically a little code. Yeah. And I would try to have a card, or have my medics have a card, because it's really hard to remember the whole thing, especially when you're anxious and nervous. Yeah. Now, in an emergency situation, pride is never the right thing. It's always good to have a cheat sheet. My wilderness medicine courses actually gave me a bandana that has some important mnemonics on it, so that if I have an emergency situation, I can remember that way. Even if I have it in my head, right? It's not the same. Yeah. So like the stuff I'm doing now, I've done many repetitions. I've trained on it in multiple different courses, and I've taught it, but it's still in a moment of stress. It's like you gotta. Well, it can be anxiety inducing. Just get this on your chin here. Alright. I'm gonna go take a little rest. I'm gonna be right here on the floor next to you. Okay? Down kind of next to your cot on the other side. Okay? If you need anything, you let me know. Okay, you yell. I'm gonna be setting an alarm to check you basically every half hour to an hour. Okay? Can I look at your palms real quick? Okay. And your fingernails? Okay, perfect. Okay. Well, yeah, I mean, it's a good reason. It's good. It's the reason in the Army we wear our blood type on our helmet. I'm really glad that you had yours here on your tags. Yeah, of course. Well, with blood, it's always good to carry matched blood, but for an emergency situation, I might carry like O negative for like very special, just in case I don't know what someone's blood type is, I can just give it to them. Yeah. Well, I think the reason that your shivering is important to me is shivering can be because you lost too much blood, or shivering can be because you're starting to have a weird reaction to blood products. I have a reaction to minor blood products, even if even if like the major antibodies are matched, like A, B, and those. There's tiny little antibodies that we don't always match, K and other little things like that. And then those sometimes can cause a minor reaction too. Yeah. There's nothing in medicine that's without risk, so even blood products are a risk. Yeah. Yeah, in the military we do this thing called walking blood bank, where you can I would actually take blood out of me and put it in you, if we matched, right? which I'm O positive, so I match most people. I match everyone except for the O negative people. So, yeah. So, yeah, I mean, that's I obviously I don't match negative people. So, but yeah, O positive matches most people, but it's not the universal donor. O negative, that's the universal, that's the ideal. So, yeah, negative is rarer, actually. It's usually most important when we're taking care of our OB patients, yeah, like our ladies who are pregnant, because if they have a different blood type than the infant or the fetus, then there can be a problem during birth. So, yeah, because the fetus has its own DNA. It's got its own Homo sapiens DNA. It's its own individual as a human being, and so it'll have completely different blood type a lot of time than the mother, because it's not just an extent. It's the difference from like a tumor or something will have the same genetics with a mutation from the mother. It won't have its own unique signature, its own unique Homo sapiens match with whereas like obviously an embryo or a fetus will. It's got its own unique DNA, and it'll have its own blood type as a result, and that's something that we've got to watch for. I think a lot of the big complications of pregnancy come because it's not a part of the mother's body. It's a separate organism, and as a separate organism, it's got its own it just has its own biology, the little he or she in there. And so a big part of it is if the mother is Rh negative and baby is Rh positive, then when baby's coming out, if their blood mixes, basically those antibodies will, attack and basically poison the baby. And mother can also have significant complications too. There's it's called isoimmunite. It's a long word. I'm not a very, I always explain things to my patients in simple words because that's how I understand them, but sometimes you have to use the very specific long medical term. Alloisoimmunization or something like that is the word. It's a long little word. Well, it's neat that you're so curious about this stuff. Yeah, sometime we'll have to go over some of it. Alrighty. Okay, well, I'm gonna let you rest, okay? You've had an exciting day. Hey, it was awesome what you did out there. Yeah, I think we're gonna be okay. And you've got the right attitude, so that's half the battle. Yeah, there was a study on performance athletes that showed that, like, athletes had less pain if they were able, like these are, like, high-performance athletes who are running, like, 200 mile marathons and things like that. They actually had less pain if they were using certain healthier psychological coping strategies from, like, pain psychology. Yeah. Yeah, I think they're on the move. I hear that too. We'll be okay here, though. I mean, you took care of the threat, so... Ideally, I think that we can continue our expedition. I think we can continue our mission. But I think we're going to have to stay here a couple days. Make sure that you're all better. Okay? Yeah, because I know you don't want to be evacuated right now. I know that this is important to you. So I think we can continue, but I need to watch you. Okay? If I'm worried about internal hemorrhage, if it doesn't look like your blood pressure remains stable, if we're having too much trouble, walking, obviously I'm not as worried about sepsis because we've got the antibiotics on board. And I know that now that the main threat is neutralized, you don't need to be doing a lot of fighting, so it's going to be a lot of coordinating and a lot of, computer stuff, the stuff that I don't know as much about, but you do. Yeah. So, we can continue. And we'll just take it easy. Yeah, we can do that. Whatever you say. I'll just put my foot down if I feel like it's, I'm gonna need you back at base for more intensive treatment. Yeah, I'm really glad you ended up joining our cause. Well, it's important. There's not a lot of people who are willing to put themselves at risk to help people who don't have the same opportunities that you do where you came from. Yeah. So, yeah, we definitely appreciate you down here. Yeah. All right. Well, thank you much. Go ahead and rest up.